A knee specialist. A one-trick pony, right? Not at the Christ Hospital Health Network. We have integrated specialists for every area of orthopedic surgery, like perfecting your golf swing again, night strolls with your partner, or walking your daughter down the aisle. Everything it takes to get your life back. We specialize in that too. The Christ Hospital Health Network, everything it takes.
The Pound This Podcast is brought to you by the Christ Hospital Health Network. This is the Pound This Podcast, episode 791, all about breast cancer with Dr. Julie Specht and Dr. Gina Chung.
I want to lose weight, but I don't know how to get started.
What should I meal prep every week?
How do I get those sweet booty gains?
Inspiration for your healthy lifestyle. The Pound This Podcast with Amanda Valentine.
What up, friends? Going to get into my conversation with Dr. Quesada here in just a few minutes. First, I want to tell you about some other super amazing people. One being Sarah and Team Fit With Me. Actually, Dr. Quesada and Sarah were both at my Pound This party, my live podcast event in my 40th birthday in August. Two absolutely amazing women. Sarah is health coach extraordinaire. So if you're looking to lose weight, you're looking for somebody to help you be accountable. If you have gut health issues, hormonal issues, she has an entire team of people. Sarah has lived through everything herself. She understands where you're coming from, no matter what your goals are. And she is a macro goddess. She is great at figuring all this stuff out and goes deep into the science. So if you're looking for somebody to help you figure out nutrition, physical fitness, mindset, all that stuff, check out Sarah, teamfitwithme.com/poundthis to save 10% off of month one of all packages and plans. And speaking of nutrition, I have to tell you about my new favorite place, Clean Eats, which has been a godsend with meal prep. So I've been a meal prepper for about almost a decade now. And it does take a lot of time, and I love meal prepping, but I also am very excited for the break. And the food I've been having is fantastic. And I know everybody that has tried Clean Eats so far has given me nothing but great feedback of how good the food is, including some coworkers of mine. And so it's meal prep where it's fresh. I order fresh every week, or you can go in and get frozen. Plus there's a cafe right there. I go to Clean Eats in Newport here in Cincinnati. There's also a Westchester location if you're in the North Cincinnati. If you're not in Cincinnati, you can find a Clean Eats near you. But here in Cincinnati, check out Newport and Westchester. Like, listen to the menu this week. I am hyped about this week's menu. So hibachi steak with tiger sauce, sweet chili chicken, mac and cheese, barbecue, bacon, cheddar chicken, Caribbean pork, south of the border bowl, which has some Mexican corn in there, which sounds amazing, and chicken fajita omelet. So what I do is, I know I'm going to have breakfast all week, so I order 6 breakfasts because I do the 21 meals. So I do 6 breakfast, and then I do 3 of each other ones, and then kind of mix and match. And then I personally plug them all into my FitnessPal and then figure out my macros and everything from there. So what I've been doing is eating 3 of their meals a day. So breakfast, lunch, dinner, and then I'm throwing in an afternoon snack and an evening snack to match my macros and calories. But the food is fantastic. It is so convenient. And for me, the price is worth the time, baby. It saves me an entire Sunday. Like, it's amazing having a day off. As much as I love meal prepping in that process, again, sometimes you need a break. For me personally, fantastic. So check out Clean Eats in Newport and Westchester here in Cincinnati. And now let's talk about the Christ Hospital and Women's Heart Health. What up, friends? Are you ready to talk about boobies? Specifically mine. We're going to talk about my very first mammogram and all about breast cancer for Breast Cancer Awareness Month. But before we get into that very informative conversation, I want to tell you about my meal prep that I've been doing with Clean Eats in Newport. Also, if you're here in Cincinnati, Clean Eats in Westchester, because it is just changed the game for me. I've been meal prepping for like 10 years, but having Sundays back where I'm not cooking and actually having more variety of food has been chef's kiss phenomenal. Everything has been great. And hey, just so you know that I am being brutally honest, I did have one meal last week that I wasn't a big fan of. It was like chicken and peaches, and I'm just a texture person with certain kinds of chicken, and I just wasn't vibing with it. So you know that I'm being honest when I talk about the food. That one, not so good, but everything else has been bomb. It has been absolutely amazing. And shout out to everybody that has let me know that they have gone and tried Clean Eats, because I mean, just the convenience alone. It's so hard to eat healthy and to stay on the thing, especially when you're hungry and you're busy. And it has been such a godsend, such a blessing in my life to have Clean Eats around. So if you are looking for some meal prep, even just to spice in a couple healthy meals, they have a cafe there too. You can go and just eat lunch. You can get some of the frozen meals. Check out Clean Eats in Newport, Kentucky, and here in Cincinnati or in Westchester, and check out and see if there's a Clean Eats near you because it's awesome. Also, you don't have to be in a physical location to see my girl Sarah and Team Fit with me because she is a phenomenal virtual health coach, and she is going to try Clean Eats as well because multiple of her health coaching clients are also trying Clean Eats, which is amazing. And if you want to know all about your macros and how to eat for your specific body, whether you have hormonal issues or gut issues, or you want to lose weight, or you just want to be healthier, or you're like, I want to gain muscle. What do I need to eat to do that? Or I want to lose fat, but I want to gain muscle at the same time because that's not easy. Sarah is your girl. So if you're looking for a great health coach that's going to teach you all sorts of stuff and be the best accountability buddy, plus she has such an amazing team, mindset coaches, personal trainers, etc. Go to teamfitwithme.com/poundthis to save 10% off of month 1 of all packages and plans. Right now, though, let's talk about breast cancer. Thank you so much for listening to the Pound This podcast. I am Amanda Valentine. I have 2 amazing women joining me today. I have Dr. Julie Specht and Dr. Gina Chung from the Christ Hospital Health Network. How are you ladies?
Good. Thanks for having us.
So I'm so excited to chat with you because I just got my first mammogram. I just turned 40 in August. So it was good timing for Breast Cancer Awareness Month. So I definitely want to chat with you about that and, you know, the process and what we should be aware of with breast cancer. But before we get there, I want to talk about both of you and your expertise in what you do and how you got to where you are. So let's start with Dr. Gina Chung. Tell me all about you.
So I have been at Christ Hospital since 2018. Moved here from Connecticut, where I was living for many years, mostly family-related issues. So I came here to join my family, my sibling, my parents. But in any case, I worked at Yale in New Haven, Connecticut for probably about 20 years. And there I focused on seeing patients with breast cancer and doing clinical research related to breast cancer. And that was really exciting. And since I've been at Christ, I've continued seeing primarily breast cancer patients. I do branch out and see some other diseases and cancers and hematology patients as well, but primarily breast cancer, which I really enjoy. I am in multiple different offices, both here in Cincinnati as well as in Batesville, Indiana. And we do some clinical research, and so we have a number of interesting clinical trials that we have available for our patients. So, yeah, that's in a nutshell.
Awesome. Dr. Specht, what about you?
So I came to Cincinnati about 2 years ago in 2020, moved during a pandemic, which was definitely an interesting challenge. Came here, recruited to Christ Hospital. I did my training at Columbia, New York City, and then practiced in Ithaca, New York, where Cornell is, for 10 years as the only female in the practice there. Saw most of the breast cancer. And then since joining Christ, I have become the director of the breast cancer service line. I'm proud to say that we have an NAPBC certification. So we are developing the program in leaps and bounds and have recently joined with Dana-Farber Cancer Institute, which can only help strengthen our program and the clinical trial opportunities, as Dr. Chung said, that we have available to the patients. I have practices in Mason and Red Bank, see patients inpatient in the hospital, and like Dr. Chung, see primarily breast, but also a spattering of other cancers and hematology.
Well, it's just, I have to bring this up, small world, because I used to live in the Finger Lakes region of New York as well. So I hit up all those wineries on Keuka Lake.
Yes, you do.
It's awesome. And so I just turned 40. So I knew that everybody had given me this like sense of, you have to get a mammogram now. This is going to be horrible. And that's just, I guess, that and colonoscopies, I guess. I'd rather get a mammogram than a colonoscopy personally.
That's 10 more years for that.
Okay. Something to look forward to. But that's where I got that it was painful. No, this, basically this process sucks is pretty much the overlying message I got about getting a mammogram. And I had it done a couple weeks ago, and it was so easy. It was not painful at all. It's literally more painful to put on and take off a sports bra than it was to do this mammogram. And I'm like, what is everybody complaining about? I guess this is something that you deal with day in, day out. I mean, I imagine that has to be just like a cultural, I can't even think of the word for it, of just that's just what people think. And then do you kind of have to walk through of it's not that bad, this is fine?
It's definitely, I think, also the fear of the unknown, right? Yeah. So people are afraid of being diagnosed with cancer. So the thought of going in for something that makes you vulnerable, that we've heard may be painful. And I agree with you. I didn't think mine have been either. But it's that kind of fear of, I'm going to go in there, I'm going to be exposed, they're going to find something. And I think that just starts this whole culture of avoidance.
Totally. And I feel like I was worried too of what if you find something? And I was told while I was there, it's your first time. You might see some dense tissue that it's probably fine, but you're probably going to get called back, and just be prepared yourself, prepare yourself to you might have to come back, and don't freak out. Luckily I didn't have that experience. I got my results back within 2 hours and everything was fine. But I imagine that has to be, just psychologically for so many people, of getting your first mammogram and there's something that's found, even though you were told not to worry about it. How do you not just dive off a cliff, freak out?
For sure. And, to that point, we have really great breast health navigators to help talk you off that ledge. If you do have that abnormal mammogram, you need to schedule a biopsy or another mammogram. We have experts that can help walk you through that process, get it scheduled, hold your hand, call you with the results if need be. So I think that helps smooth out that process and take away some of that fear.
Yeah, absolutely.
So Dr. Chung, tell me about when do I know I need to get a mammogram? Do I have to wait till I'm 40? And then, is that something when you turn 40 you have to do? What's the process of getting a mammogram?
So the guidelines are that for your average risk woman, it is age 40. So that's a recommendation. Of course, not everybody follows it and not everybody does it, but that's a recommendation. For patients who are felt to be higher risk, and that's, a little nebulous how that's defined, but certainly somebody with a strong family history, somebody with, let's say, a known mutation in a hereditary breast cancer gene like BRCA1 or 2, those are patients who we may want to look at more closely and perhaps start earlier, add a MRI, do it more frequently. It's adaptable. And I don't know if Julie, if you can speak to this a little bit more. We do have that.
I was just going to mention that. So we have a high-risk breast cancer clinic, or a breast clinic. So this is for patients who can either self-refer or their physicians feel like they may be at higher risk because of family history. We have a specific high-risk clinic where those patients can go and be screened for their specific risk to see if they qualify for genetic testing, possibly because of their family history, for breast MRI, or even for what we call chemo prevention. That sounds like I'm giving you chemotherapy, but it's actually not. It's anti-hormonal therapy. And some women can take a pill a day for 5 years to reduce their breast cancer risk by 50%. So this clinic is great. It can screen patients for that, get you set up for what your most appropriate screening is.
I guess I would ask, how would you define family high risk? My grandma had breast cancer, but does that make me high risk, or does there have to be multiple people in your family?
The closer the member is to you. So obviously if it's your mother or your sister or, God forbid, your daughter or somebody like that, that would enhance your risk. And then as you get further and further out, it becomes less and less. And there are models out there to sort of look at all the different factors, when you started having periods, when you went through menopause, family history, all these kinds of things, models you can use to calculate, sort of roughly calculate your predicted risk. So those are the algorithms we use to sort of a little bit more quantify your risk and determine whether or not you're a candidate for the prevention drugs and things like that.
And one of the things we have, if you get your mammogram here at Christ, and I can't speak to the other facilities, but we have something called the Gina chatbot. So it's a program where patients prior to their mammogram, ideally prior to their mammogram or when they come in for it, have this online program where they can fill out their family history, their personal history, if they've ever had a breast biopsy before, when they started their periods, how many children they have, and it will estimate a lifetime risk of breast cancer. And if that's flagged as a high lifetime risk, that goes to an alert right to their primary care provider to say, hey, consider sending this patient to this high-risk clinic. So I think it's a great way to throw a wide net and capture a lot of patients.
Okay. So what are some like signs and symptoms? I know that like other than feeling like a lump, that seems like a pretty obvious symptom, but is there anything else that we should be looking out for that would tell us like maybe we should get into the doctor?
I mean, a lot of women are concerned, for example, if they have breast pain or breast tenderness. Generally, in terms of breast cancer specific symptoms, that's usually not a big one. So I try to reassure patients that, people can have breast tenderness from fibrocystic disease and other kinds of benign etiologies. So not so much that, the majority of patients who get diagnosed with breast cancer are either because of screening mammograms or because they've palpated a lump.
Other things to look out for, I completely agree with that. Other things to look out for are changes in the shape of the breast. So sometimes if the nipple starts to change from, it starts to change and go in instead of out, or the skin feels thick or different, that can be an indication that something's going on. Nipple discharge, sometimes nothing at all. Sometimes it can be an indication that there's a problem. So that's a good reason to contact your provider.
Or I guess lumps underneath the arm, if there's lymph nodes involved, that kind of thing.
How often do you see like women, I guess, or men too, that have these sort of symptoms or feel something and are like, oh, I just don't want to deal with this. So then just don't come in because they just don't want bad news.
Yeah, unfortunately, we do see that not that infrequently. Unfortunately, we sometimes see patients where it's way beyond with, open ulcerated masses and things like that. And obviously in those situations, and these are often very functional people who are out there working every day and whatnot. So denial and sort of fear, I guess, is the main things driving that. It's not a common occurrence, but we do see it.
Yeah. And the other thing that we've seen, unfortunately, at least I feel like I've seen in my practice, is patients who didn't get screening mammograms during COVID, that kind of avoided going out for COVID and then got into that pattern of, maybe they missed their first one because at the beginning of the pandemic, no one knew what to do. And then just said, oh, well, it fell off my radar. And so I feel like I'm seeing patients that are presenting later because they missed those screening mammograms.
Oh, so this would be a good reminder to go in and get that done. I just feel like so much of the things I talk about all the time are just preventative measures. And it feels like, I think especially as women, it's like, oh, I'll get to that later. I'm really busy. I'm going to put myself on the back burner. I have other things to do. I'll worry about taking care of myself later. And then all of a sudden, things kind of escalate and get out of hand. And you're like, oh, I should have done something about this when I first thought about it however long ago. And it just feels like, I think that's what's great about having like Breast Cancer Awareness Month, is one of those things that kind of like puts it in your face of like, no, this is just a reminder to go get a screening, to go get checked out, to take care of yourself, and don't not think about it until it's too late.
For sure. One of the things one of my mentors did when she started getting her mammograms was get it her birthday month, and always said it was her birthday present to her own health. And so I've started doing that. And I know every February, oh, it's February, got to get my mammogram. So another trick to remember it.
Good idea.
So are there things, I know that, I've heard stories about things, well, I mean, you watch TV, you see anything of like, this could cause risk of cancer and things like that. And I mean, I don't know if you want to go down this whole topic, but even just talking about like some birth controls and stuff like that, that can have side effects of or causing breast cancer. Are there things that we should be watching out for that do cause breast cancer that aren't hereditary?
So, there are not that many modifiable risk factors. So, you have risk factors that you can control and those that you can't. So the ones that you can control is moderation of alcohol usage, post-menopausal weight gain. So that once you go through menopause, your fat cells are becoming more of a producer of estrogen. So that increases risk of breast cancer. Most of your risk factors, honestly, are not modifiable. So it's just really paying attention to screening and your family history.
And if they are modifiable, it's probably a pretty small part of the whole picture. So, some people get very down on themselves, beat themselves up and say, oh my God, it's because I had too many glasses of wine, or I didn't exercise enough. And I would say those are not major risk factors. So,
agreed.
Yeah.
And then there's things that we know definitely don't cause breast cancer, but we hear patients afraid of it all the time. Like, I should never have worn that aluminum deodorant, or those underwire bras caused by breast cancer. And that's just not accurate.
I haven't heard the underwire bra one. I'm like, I don't think I could survive without an underwire bra. So.
I don't think anyone wants to see it.
Well, I mean, that's good. I mean, obviously, so, I mean, with everything else, if you want to have like a healthy, active lifestyle, I know I've talked to so many doctors and researchers just even about how minimal amounts of movement and exercise work in prevention with so many areas. I assume that's probably the same thing with breast cancer as well.
And it's especially important because of all the sort of things that are involved in breast cancer. God forbid, if you are diagnosed with breast cancer and we give you, let's say, endocrine therapy, anti-estrogen therapy, a lot of that involves bone health and things like that. And some of the side effects of our medications are alleviated or at least mitigated to some degree with being active and exercising. So that's usually a big part of my discussions with patients.
Absolutely agree.
So are both of you accepting new patients? I mean, in your line of work, is it you're somebody that does these screenings, have these conversations with people, or are you somebody that once you've been diagnosed and you have an issue, then you come to you?
So we're both more on the once you're diagnosed side. Every once in a while, we have patients and their family members feel like they're high risk and they'll come to us through that venue. Generally, they go to the high risk clinic, and we tend to see patients once they're already diagnosed. And we are both absolutely accepting new patients and happy to see anyone. And
work closely with the breast surgeons and
radiation
and the whole team of breast cancer providers. So.
And our team, definitely team approach, and it includes genetic counselors and dietitians and social workers and physical therapists, and really believe in a team approach to taking care of patients.
The survivorship program is excellent here. So, yeah.
That's awesome. Well, Dr. Chung and Dr. Specht, this has been great, so informative, and I hope this encourages everybody to get a screening and take care of themselves and gives them some good information about what to look out for and what not to worry about. So thank you so much for your time.
Thanks for having us.
Thank you.
AmandaValentineBites.com